Today, we're very excited to host a collaborative presentation with our guests from RMA and Alberta Munis on linking healthcare, municipalities, and people. Today, you'll hear from each organization on how they support rural. The first person I'm going to introduce is Kara Westerlund. She is the president of Rural Municipalities of Alberta. I'm just going to stumble over everything there. Kara Westerlund was elected president of RMA in November 2024. She is the first female president in RMA's 116-year history. Prior to this, she served 3 terms as vice president, having been elected in November 2017 and re-elected in 2019 and 2021. Kara entered politics in 2010 and is serving in her 4th term as a councillor in Brazeau County, now as Deputy Reeve. Kara is passionate about serving her community and strongly believes that the decisions made around the council table affect the community in the short term and have long-lasting effects. We also have Deputy Mayor Debra Reid-Mickler from the Village of Duchess and Vice President, Villages and Summer Villages Alberta Municipalities Board. Debra is a 3rd-term councillor for the Village of Duchess, currently serving as their deputy mayor. She is a passionate and vocal advocate for all rural communities. She was first elected to council in 2017 and has served as chair, vice chair, and secretary-treasurer on several committees and boards. She is the current vice chair for the Regional Water Cooperation and the vice chair for the Library Trustee Board and serves on the Regional Health Advisory Council. Shanda Berns, who is here at RhPAP, is Senior Manager of Community Development and Engagement. Shanda grew up on a cattle farm in Northern Alberta and comes from a long line of grassroots rural champions with a focus on community connection and integration. Her passion and expertise for community capacity building, systems planning, and gaps analysis is evident in her previous roles with municipal governments and the rollout of targeted projects to assist vulnerable populations access services in critical times. With a focus on strong and healthy relationships and networks, Shanda is passionate about continuing the work of the Rural Community Development and Engagement team here at RhPAP and ensuring our community's unique needs and voices are heard. So speaking of Shanda, I will now turn things over to her to get us started with our first presentation.
Thank you, Alicia. All right, I'm going to share my screen here. All right, so good morning, everybody. As Alicia stated, my name is Shanda Berns, and I am the Senior Manager of Community Development Engagement here at RhPAP. I'm looking forward to sharing information about RhPAP with you, and I'm so excited to have our partners with AB Munis and RMA with us today. So firstly, our mission as an organization, it's to build a stronger future where quality healthcare is accessible to rural Albertans. We strive to meet this vision by partnering with our many key stakeholders across the province, such as government, health authorities, and community champions. Our mission is to serve as a trusted voice, building solution-focused partnerships and delivering initiatives that support rural communities in their efforts to keep healthcare close to home. This presentation touches on many of RhPAP's initiatives that support this. So RhPAP is unique in its approach to keeping healthcare close to home by providing professional development opportunities to practicing healthcare professionals in rural, bursaries and rural experiences to student healthcare learners, and working with grassroots attraction, integration, and retention committees, just to name a few. So RhPAP has 5 areas of focus that you can see here. So we have high school to healthcare, post-secondary to practice, investing in health professionals, creating community capacity, and demonstrating impact. So with each of these, I'm going to dive a bit into more of them in the next few slides and give you some examples of where we focus our efforts. So firstly is our high school to healthcare. We host a number of Let's Go Rural high school events, which I'm sure many of you on the call right now have experienced, or maybe you've experienced as a student and you've decided to go into healthcare and that's piqued your interest, so that would be fantastic. But we host a number of these across the province every year where RhPAP partners with local schools, health professionals, community members, and other key stakeholders such as Careers Next Gen for a hands-on learning experience for junior high and high school students interested in healthcare careers. We host 4 virtual How Do I Get There sessions a year that highlight a healthcare discipline, which discusses schooling requirements, what makes practitioners choose rural. So we'll usually have rural practitioners come in on the call, discuss their experiences and why they love practicing in rural to really try to pique that interest in rural healthcare. And it also provides an opportunity for students and their support systems to ask questions. That's generally why they log on. They have a lot of questions about certain things, and they have been a hit thus far. We sponsor various camps, from medical summer camps to grassroots-led initiatives that help cultivate the pipeline from high school to post-secondary to rural practice. I want to put in another little plug here for our Let's Go Rural experiences. We have an expression of interest open right now for both our high school and post-secondary events. So if you, your community, your healthcare team is interested in hosting an event, please check out our website and put in an application. We'd be happy to hear from you. So RhPAP supports post-secondary students in a variety of ways, and I'll touch on that a bit. We provide rural learners free accommodations during their rural rotational stays, and that is in direct collaboration with our post-secondary partners. Our Rural Healthcare Student Awards are $5,000 each, and we distribute 4 awards to medical students and 6 awards to healthcare students each year. We've had an incredible response this year, and we are so excited to see who the successful recipients are. We partner with rural emergency physicians on the Rural Mentorship Program, where students can sign up to shadow a rural physician for an emergency department shift and get hands-on learning experience directly in that rural setting, which has been incredibly valuable. We partner with rural communities across the province on hosting those Let's Go Rural events that bring post-secondary students currently enrolled in a healthcare discipline to a rural community to experience what living, working, and thriving in rural truly entails. And our next one is in Olds, and we're very excited to be there. Again, another plug for our expression of interest. It's open. If you or your community is really interested in the Let's Go Rural portfolio, please put an application in. The RhPAP's accommodations portfolio is vast, and it's ever growing and changing with the demand. We are currently sitting at 154 leased properties, working with our rural landlords to provide high quality accommodations to student learners throughout the province. I'm sure many of you have heard of our accommodations portfolio. We have expanded outside of just our medical students to include all health disciplines. And as you can imagine, the demand is incredible, and we are doing what we can to house as many learners as we can. The RhPAP's professional development portfolio is targeted towards rural healthcare professionals looking to scale up their skills and meet the unique demands of rural practice. From physician skills enrichment to team-based learning, our PD opportunities are not a one-size-fits-all approach. As any of you that are in rural, grew up rural, practicing rural, you know that every day is different and the skills need to meet that. And that's where our PD kind of comes in. RhPAP works with the Alberta Medical Association on providing weekend locum services in rural communities. And in collaboration with Advanced Education, RhPAP administers the bursary for internationally educated nurses through participating post-secondaries across the province. So some of you may be a recipient of our BN bursaries, and some of you may be working with recipients of BNs. And it has been quite successful, and we're looking forward to getting more BNs employed in rural. Our Rhapsody Awards that we offer are opportunities for communities to celebrate an exemplary, that's such a hard word for me. I don't know why I put it in my notes, but I'm trying. Rural physician and healthcare hero. Applications for our Rhapsody Awards are currently open and they close February 27th. So get your applications in. We would be very, very happy to award those physicians and healthcare heroes in your community. We demonstrate our impact in a variety of ways by sharing rural success stories, providing a monthly newsletter that highlights what RhPAP has to offer and how rural communities and healthcare professionals alike can get involved. We have a strong presence on social media with our Facebook, Instagram, X, and TikTok accounts. If you haven't followed them yet, now is the time. Our Marcom team are absolute rock stars and doing their best on those, and it's fantastic. We frequently present throughout the province like this to a variety of audiences such as town and county councils, post-secondary institutions, and rural advisory councils, just to name a few. As stated before, one of RhPAP's key focuses is early exposure to rural healthcare careers and what it means to live, work, and thrive in rural Alberta. The numbers on this slide speak for themselves, and they are continuously growing. Similarly, our professional development funding we provide has seen high success with some of the statistics of these trainings seen on this slide. To note, much of the success goes hand in hand with our partnerships with our key stakeholders throughout the province that provide rural-specific training opportunities. We couldn't do it without them, and we would not be successful without them. So thank you for the partnerships. At RhPAP, we believe that each community is unique in their needs and thus may require different supports and approaches in their attraction, integration, and retention efforts. The Community Development and Engagement Team, which Alicia, our lovely host, is a consultant on that team, and I'm the senior manager of that team. We work with about 62 attraction, integration, and retention committees across the province on their grassroots A&R efforts, which has seen mass success, and it is also incredibly unique in Canada. There's not many other provinces that have the network that we do, and we are looked as kind of the gold standard, which is fantastic. We have a vast volunteer support system focused on these efforts and have a modernized toolkit to help each unique community achieve success within their committee structure and at large. And I wanted to put a little note in there. So this toolkit was an effort of love. And Debra, who is presenting and co-presenting here, was part of the working group on that toolkit and provided incredibly valuable feedback. And so I wanted to thank you, Debra, for that. This toolkit can be found on our website alongside various resources to assist and videos of me. So if you want to see my face again, hear my voice, you can just go to our website and see videos of me because I'm all over there. RhPAP's focus on collaboration with key stakeholders has seen incredible success and strong partnerships across the province while moving the needle together on various advances in programming and supports for rural communities and healthcare providers as seen on this slide. So our partnerships with post-secondary institutions, government, community groups has really led the way in many changes that we've seen today that you can see on this slide. And we're really looking to grow that impact and demonstrate how we can be a partner and a valuable resource at the table. RhPAP hosts a biannual conference. So I've noticed that many of you on this call have been at the conference. Again, you'll see my face. I am the MC of that conference, and this year it is hosted in Peace River. So from incredible speakers to networking events and exploring what the community has to offer, RhPAP's conference is a fantastic opportunity to engage and learn with your rural counterparts. Early bird tickets will be going on sale April 1st, so keep an eye out for this in our newsletter, socials, and our website. In conclusion, RhPAP's reach is vast, aligning with Alberta's Rural Health Action Plan in a variety of ways. We will continue to provide rural Alberta the support needed to help keep healthcare close to home. And that is all. So if we don't get to your questions in time, the info@rpap.ca, you can send your questions there. And I know that Alicia will be putting that in the chat, or Emily, just depends, but it will be accessible to you. And thank you, everybody.
Thanks so much, Shanda.
You're welcome.
I'm glad I'm not the only one who trips over my words. It made me feel better.
You know, I used to teach high school. I'm like, why am I like this? Like, why?
All right. You're still an exemplary speaker.
Thank you.
All right. Yeah, thank you so much, Shanda, for that. And we are going to move to our next speaker. So I'm very excited to welcome Kara from RMA, and she's going to give us a rundown of how they work and some of the community initiatives that they have going on. So over to you, Kara.
Thank you so much, Alicia. Truly an honor to be here. I am Kara Westerlund, president of RMA, as well as a deputy reeve from Brazeau County. RMA is proud to represent Alberta's beautiful 69 counties and municipal districts, helping them achieve strong and effective local government. A neat fact that I like to share with everyone is we represent about 85% of the landmass, but less than 15% of the population. So that tells you we do have some truly unique challenges and opportunities when you talk about rural Alberta. So we are so lucky to be able to partner with RhPAP on many different initiatives and are happy to be here today to discuss our healthcare related priorities. Across rural Alberta, we know that healthcare is more than a government service. It's the backbone of community resilience. When a resident can see a family doctor close to home, when an ambulance arrives quickly, when a hospital stays open, it keeps our communities safe and healthy. But as you all know, rural healthcare is under strain. Workforce shortages, system restructuring, and uneven access to services are creating real challenges for people that we serve. That is why RMA continues to make healthcare a high advocacy priority. Healthcare is foundational to the strength of any community. When people can access care close to home, they are healthier, more secure, and better able to participate in community life. Healthcare also is not just a social service, it's the economic driver. When our health services are stable, people feel confident building their lives in rural communities, and that stability boosts the overall quality of life. Distance, transportation barriers, and limited service availability all make accessing care more difficult in rural areas. What might be a quick appointment in an urban center can become a full day trip for rural residents. These challenges mean that rural communities need tailored solutions, not one-size-fits-all approaches. Rural Alberta is already facing chronic shortages of service providers. Ongoing system restructuring adds uncertainty and strain to these issues. Without a stable workforce, service becomes inconsistent, wait times grow, and communities feel the impact immediately. RMA has and will continue to prioritize healthcare in our advocacy initiatives. We want to ensure equitable access to care for all rural Albertans, secure rural representation in healthcare system decisions, and promote sustainable long-term workforce solutions. We are so proud to work alongside our members and other stakeholders to advocate on resolutions that speak to the need for healthcare solutions in our rural communities. The first resolution I would like to highlight is Resolution 5-22S. As the province undertakes major restructuring or healthcare delivery, RMA members have been clear that rural Alberta must not be an afterthought. Decisions made in Edmonton or Calgary without rural representations risks deepening inequities we already face. The resolution calls for a dedicated rural general practitioner or nurse practitioner to sit as a voting member on the Integration Council, because our members know that people who understand rural healthcare must be at the table shaping its future. Another priority is strengthening the rural healthcare workforce. This resolution highlights a practical, evidence-based approach. Physician assistants are already proven to expand capacity, reduce wait times, and support team-based care. They can be especially valuable in rural communities where physician shortages are chronic. RMA is urging the province to provide stable funding and formally integrate PAs into primary care and emergency settings. This is not about replacing doctors. It's about ensuring residents and rural residents have timely access to care. We know that no single profession can solve the rural healthcare crisis. That's why Resolution 1-24F calls for a comprehensive province-wide plan. Rural Alberta needs more than short-term recruitment incentives. We need coordinated strategies that address housing, training pathways, community integration, and long-term workforce planning. Without a stable and diverse healthcare workforce, rural hospitals and clinics will continue to suffer, and our residents will continue to feel the impact. As municipal leaders, we see the impact of gaps in the healthcare system every single day. We hear from residents who are struggling, and these stories fuel our advocacy, and they remind us why this work matters and why it's so important. RMA is and will continue to be committed to working with our members, the GOA, RhPAP, and all other relevant stakeholders to advance rural healthcare initiatives in the province. We will help identify unique solutions that are tailored to the needs of our residents, and we will work to ensure that everyone gets the access to care they need and deserve. We're committed to providing our members with up-to-date information on what is going on in the healthcare sector and how these things will affect rural communities. I encourage you to go to our website and sign up for the Contact newsletter to get quick access to that information. Rural Alberta is strong, resilient, and innovative. With the right support and meaningful collaboration, our healthcare system can be too. And I believe that brings me to the end of our presentation, and I will hand the floor back over to Alicia.
Thank you so much, Kara. It's great to hear all of the work that you guys are doing and the resolutions that you've made and the dedication that you have to our rural communities and the healthcare there. So thank you for all of that information. I will hand it over now to Debra with AB Munis, and she's going to be giving us some information there and how those healthcare municipalities and the people are all linked together and can collaborate. So over to you, Debra.
Well, good morning, everyone. I'm happy to see so many people taking valuable time out of their day to join us. So welcome. And I did notice there's quite a number of names on there that I recognize. So hi to all of you. I am the Vice President for Villages and Summer Villages on the Alberta Municipalities Board. And so I have a unique perspective from the entire province on healthcare, and I hear about it constantly in all our municipalities. One thing that I will add that I've been involved in that wasn't in my bio, just for interest, I've also been serving on the committee that is establishing and carrying forward the new rural doctor training program out of the University of Lethbridge in conjunction with the University of Calgary. I'm really excited to say we get our first intake starting in July this year. And I will be, I've actually been invited to be on the interview panel for ensuring that the applicants, the people that we offer positions to into that program, have a real rural focus. So that's super exciting. I know the same thing is going on in Grand Prairie too. So that is major excitement for the healthcare world in rural. I'm here today to share a bit more about who we are as Alberta municipalities and the work we do to advocate for access to healthcare throughout the province. I'm going to give you a brief overview of who we are, our access to healthcare as a priority initiative, and it is, share a uniquely healthcare focused success story, and give you some insights into the plans we have for 2026. So who is AB Munis? Founded in 1905, AB Munis represents and advocates for summer villages, towns, cities, and specialised municipalities. The municipalities in which 85% of Albertans live, which tallies nicely with Kara's number of 15%. So at least we've got our numbers right. Although we represent what is known as the urban municipalities, 78% of Alberta municipality members have a population of under 5,000 people. And what do we do? Well, we advocate on behalf of our members to the province and federal governments on key municipal issues. We work to strengthen local democracy and municipal autonomy, ensuring local voices shape provincial decision-making. Access to healthcare has been a priority for AB Munis and its members for many years. These efforts have ranged from advocating for improved emergency medical services, delivery, physician attraction and retention, integration of nurse practitioners into the health system, as well as capital investments into hospitals and other healthcare facilities. Often, given that municipalities are the closest level of government to Albertans, we as elected officials or local government administrators are the first to hear of the issues and see how limited access to healthcare impacts our constituents. However, we are not just the jurisdiction with the responsibility to deliver healthcare. This falls to the federal government to fund healthcare and the province to deliver these services to all Albertans. So by focusing on access to healthcare, AB Munis aims to advocate to the jurisdictions that have the responsibility for the funding and delivery of healthcare, as well as share success stories, challenges, and identify potential solutions. Currently, we have 6 active resolutions on healthcare, all of which are focused in some way on increasing access across the province. That was a tongue twister. Rural participation on the Integration Council for refocusing Alberta's healthcare system. Midwifery as an option of care for all Albertans. Attraction and retention strategy for rural healthcare professionals, integration of nurse practitioners into the Alberta healthcare system, and we know a lot of that has taken place, but it's still active on our books to follow through. Expanding capacity to train combined laboratory and X-ray technologists. This is huge for rural. It's mainly considered complete, but it is something that we're keeping a very close eye on to make sure that it actually meets the needs. And sustainable community hospice funding model. Advocacy isn't always a straight path, as many of you know, and it often takes longer than expected. It always takes longer than we want. But the story I want to share today is one that starts with you, our members. In 2015, the first resolution on nurse practitioners was passed at convention, sponsored by the village of Wabamun. In 2016, the province launched the $10 million nurse practitioner demonstration project to explore increasing the use of nurse practitioners in the primary healthcare system. Building on the success of that pilot, the province announced the Primary Care Network Nurse Practitioner Support Program in March 2019. This provided $38.5 million over 3 years to support nurse practitioners already working in the primary care networks and to hire 50 more over 2 years. When it became clear in 2020 that this funding might be at risk, AB Muni's board stepped up and sponsored a new resolution to keep the issue a priority. AB Muni's continues to amplify member voices, advocate directly with the provincial officials, and educate members on the role of nurse practitioners. Beginning in 2020, the province also started addressing several legislative barriers that had limited the scope of practice of nurse practitioners. In 2023, the town of Wembley sponsored another resolution to continue advancing this work. In 2024, in the spring, the province announced the Nurse Practitioner Primary Care Programme. Since then, 33 nurse practitioners have begun providing care, primarily in rural communities, and another 23 have been approved to begin practicing independently through the programme. Although it took some time, nurse practitioners can now provide comprehensive patient care autonomously, either by operating their own practices or working independently within existing primary care settings. With these additions, more than 31,000 Albertans in rural communities now have access to timely primary care. Just this past September, the town of Wembley announced that it had purchased the community's only medical clinic. It will be operated by 2 nurse practitioners, with plans to add a third. Each nurse practitioner will take on at least 900 patients, and that's huge for that region. As the nurse practitioner example demonstrates, advocacy takes many forms. It's not only about sending letters or individual meetings with ministers. For AB Munis, this can include building and maintaining relationships with the provincial and federal governments. AB Munis is often asked to participate in government funding programs or to disperse funds to members. We host government representatives at our flagship events such as MLCs or convention, both to share information and to facilitate engagement on member-driven issues. We facilitate engagement between government and our members. Meetings between provincial and federal elected officials and the board, committees, president, or staff also routinely take place to discuss significant issues impacting municipalities. And in fact, this morning I was at a breakfast speaking with the Premier about a few more of our issues. So we're always working for you. In 2026, for the strategic priority of access to healthcare, AB Munis will be focusing on 2 key advocacy strategies. The first is engaging with members to prioritize and build common solutions that strengthen municipalities. The Health and Social Wellbeing Committee will explore municipal role in access to healthcare, discuss what is within municipal responsibilities, identify successful advocacy strategies, and analyze why they're successful, such as the success we've seen around the integration of nurse practitioners, and increased focus on education of rural healthcare providers, such as training, lab, and X-ray techs, which I mentioned earlier. This will help define future advocacy strategies. We will aim to build and reinforce relationships within Alberta's new healthcare structures. And we have a number of members and member municipalities, and I know RMA does too, that are serving on the new regional advisory councils. And this really helps us to reach our arms into all aspects of healthcare advocacy and guidance. In addition to ensuring ministerial attendance at MLC and convention, we bring in ministers and GOA officials to meet with the board and executive and the health and social wellbeing committees. Minister LaGrange is expected to meet with the executive committee in February. I'm looking forward to that one. We will also aim to have key officials from primary and preventative health meet with the health and social wellbeing committee this year. The second key strategy will be supporting members through education, communication, and resources to address municipal challenges and opportunities. Ensure members have resources about attraction and retention of healthcare professionals. And this is one of those instances where we're doing that, is partnering with our great partnership with RMA and RhPAP to do that, so that you understand the role of RhPAP itself, because I can tell you when I first came on council, it was a closed door to me, and there were very little resources out there to explain what they did. So it was really eye-opening. So I encourage you, if RhPAP is new to you, please access information to what they do, read up on them, and get engaged with them, because they are critical for rural health delivery. We are also going to be following up on the resolution on midwives. We are hoping to host the Alberta College of Midwives and the Alberta Association of Midwives at our Health and Social Wellbeing Committee to identify opportunities for joint advocacy. A panel at convention potentially on retention and attraction success stories, but this needs to be confirmed yet. We will be enabling AB Muni's active participation in key spaces. We participate on the UFC Faculty of Medicine's governing body that is looking at inclusive governance. I can speak to that personally because I am actually the representative. And I served on that with the past RMA board member, Amber Link. And we were very successful in advocating a successful resolution that went to both organizations and passed in advocating for easier and more supported access to further education for rural students. And that's not just for healthcare initiatives, but for all students, because there are significant barriers to some of those students accessing, whether it be through access to timely courses that they need, or access to those extra pieces that they need for their resumes to get their applications in and be successful to the programs that they want to be in. So that's been fantastic. We also attend our RhPAP convention in October. There will be several members of AB Munis at that convention. And we just continue to engage with all the partners on the delivery of rural health and be a voice, a loud voice for all of you in improving rural healthcare delivery. Thank you, and I'm looking forward to any questions you may have.
Perfect, Debra. Thank you so much. It was great to hear more about AB Munis and all the work that you're doing, and really appreciate all the advocacy and information that you have and the resources. So thank you for that. All right, so we have now come to the end of our official presentation, but thank you so much to Kara and Debra and Shanda for sharing all of that. We'll take we probably have about 10 or 15 minutes now to address any questions from you as the audience. So if you wanted to, I didn't see any yet in the chat, but you're welcome to put those in there.
Myrna, I see your beautiful hand.
Hi. So happy to have everybody join us today. And I think it's great that we're coming together with AB Munis, RhPAP, and rural municipalities. I'm just wondering if you guys also work with Healthy Age in Alberta, because I know that's part of the criteria moving forward on how it's going to work with municipalities. And I'm just wondering if there's a fit for them sitting together as a discussion too, because I sit as a CLC member for Northwest Regional. member for Healthy Aging Alberta, and I just see some of this stuff that, like, for community gatherings are coming out. This coming out soon, I guess in April they're starting, and the dates aren't confirmed yet. But I think a lot of members on this call would be very interested in making sure that their municipalities are being represented or part of that opportunity, because there's some grant opportunities, some funding, and some, I guess, presentations that could be done so that there's some new programs being built for continuing to stay healthy in community. So I just wanted to put that blurb in there.
I can speak in terms of RhPAP and what our involvement is with Healthy Aging Alberta. So I sit on various tables with Healthy Aging Alberta, as I know you know, Myrna. But also our RhPAP CEO is part of the adjudication team
How did you
for
have? I thought you put it down
the
right there.
model. Yeah, so our CEO is part of the service model adjudication team and is helping shape kind of healthy aging as it moves forward. So we are heavily involved, but I think there is still some future collaboration we can do.
Excellent. Well, mine might be just a little bit of a different take on this. Actually, I honestly don't know too much about the program. So what I can share is I'm actually very excited to learn and find out what the work you're doing and how things are going and how maybe we could help out. So we may have to connect offline, and hopefully we can make that connection with the organization and ours and see where we can be a good fit and where we can help.
Yeah, actually, Myrna, thank you for reminding me, because you make a really good point. They are a key partner in this. And Tara, can you put that on the list for the Health and Social Wellbeing Committee to look at maybe reaching out to healthy aging? And I will say, from a personal perspective, Duchess, again, I kind of fell into it quite by accident, found out about the grants, attended their information sessions, and we are a recipient of one of their grants currently. And it's a small amount of money. We actually met with the premier recently, and we told her how much we'd done, and she said, "So you spent it all?" It was $10,000. And my CAO looked down at her notes and came up and said, "No, we haven't even spent half of it yet." And it was a great time to make that point that you give a smaller or rural community $1 and they'll turn it into 10. So we got a $10,000 grant to deliver seniors programs related to healthy living in place in Duchess, and it's been a phenomenal success. So any of you on this call today who haven't engaged with Healthy Aging Alberta, please do, because they are a fantastic resource. The people that are running that program are amazing to work with. They're super nice people. And yes, thank you, Myrna, for reminding me that we need to get AB Munis involved with them too.
Yeah, I think that it's undersold or underheard of at this point, and so that's why I wanted to make that message, being that there's a lot of municipal leaders on this call, to make sure that they have an engagement or part of community engagement sessions coming up. So, thank you.
It's Wayne Button, town of Daysland. I spent 41 years in healthcare, and I'm wondering, do you routinely meet with the College of Physicians and Surgeons? And if not, I would highly recommend it. One of the things that I think are and has become a bit of a detriment to general practice physicians and those going into it is the scope of practice. And I don't know whether there's been any change in the scope of practice or not, but I think that discussions around that would be hugely beneficial to try to promote folks going into GP practices. The rural locum program is a wonderful thing. It has served and it's done things, but it also comes with a downside, and that is that folks are not interested in actually setting up their own clinics and whatnot, because they can take a week here, then go skiing, and then take a week, and it isn't really getting to the point of actually getting physicians to start and get into clinics. So I'm wondering if you do have discussions with the college, and if not, I would certainly recommend it.
Hi there. Ida Edwards. I'm from the town of Athabasca, councillor. Are you aware of the regional advisory committees across the province that were formed last year?
Yes.
Yeah, so I serve as vice chair on Zone 5. And how are you interacting with these organizations?
So in terms of RPAP, we are working on presenting to the Regional Advisory Council. So if that is something that you're interested in, please do reach out and we will get the appropriate consultant to present and see how we can collaborate and support. I know that they're working on a lot of the strategic planning and how to move ahead and seeing if we can merge the two. So I'm happy to do that and see where we can have some inroads there. But we are presenting actually Alicia and another consultant, Anya, with the CD&E team are presenting on January 26th in Red Deer to the RAC there.
Yeah. And I think maybe I'll jump in there too as well, and actually to answer both questions because I believe Wayne had a question too as well. So I'm going to say yes to both. And I actually have one of my key staff members from the RMA office on the video as well, and on the call, and she's going to jump in and provide a lot more detail than I'm able to provide. But we absolutely are working. Back to Wayne's question with the physicians, absolutely, and with the new group too as well. So maybe if Callie, if you can unmute yourself, you've probably got way more details and than I do have on this.
Yeah, kind of like what Shanda was saying, we are working with the regional advisory committees in terms of figuring out the way to best collaborate on a larger scale with the entire group of you guys. So we're not sure if that looks like a broader presentation or more individualized type products that we can work with you guys on getting out and making sure that you guys know about the rural municipalities and the rural municipalities know about you. So we're excited to kick that off once you guys are up and running and ready to go.
I just wanted to touch on Wayne's point too in terms of RPAP and CPSA in the college. We do have Dr. Kandikar as part of our board of directors with RPAP that represents CPSA and really drives home RPAP's kind of efforts and locums and the CPSA in the college. So we have a very strong relationship with the college.
Thanks, Shanda. I was going to say, if you wanted to kind of touch on that piece and then
you betcha. Yep.
if Debra had anything to add there. I know we have one individual with her hand up, and I did see a question pop up in the chat just before that. So we'll let Debra speak to the pieces there. We'll go to the chat and then we'll go back to the hands raised there.
I can be very quick, ditto. And yes, we are going to be doing some more advocacy or engagement with the RACs also. I know we have a number of our members that are actually serving on them. So that's just being worked on how we look at, reaching out to them from Alberta Municipalities standpoint and seeing what we can work on. So ditto.
All right, perfect. There was a quick question there in the chat. What support does RhPAP provide to municipalities in assisting in integrating the physician and their families, and how does that connection take place? And I'm really excited for this question because this is like what I do. So
that's your bread and butter. Yeah. I can answer and you can supplement if you want, Alicia. So RhPAP works with attraction, integration, and retention committees across the province. So as I said in my slide, we have 62 currently, and this is their bread and butter. So if the physician resource planners across the province have a really strong connection with those committees, they will generally know when physicians are coming into the community, their date of arrival, if they have children, all of those arrival questionnaires. And the connection is usually made either by the PRPs or the site manager. Like it just depends on that community structure to that committee. And there's usually a community champion that will help integrate that particular physician in that family and meet the needs where they're at. So oftentimes, they will have a conversation with them on what it looks like for them, because some of them might need a lot of support, and some of them might just need like, you know what, I just need to know where my kid can go and play sports or something like that. So they meet them where they're at and continue on that particular trajectory. So bread and butter, attraction, integration, and retention committees, and utilizing our key contacts with our attraction and retention committees to help integrate them. And oftentimes our committees have municipal representation on them. So the municipalities are aware that they're coming if there's a committee there. So that is my take on it. And Alicia, you can supplement if you'd like.
Sure. I mean, you gave so much good detail there. Just throwing it back to those communities and the part where you had said every rural community is is a little bit different. They've got their own flavor to things, and they know it. They're the experts, right? So we defer quite a bit to the community committees and the champions there in the communities who are able to say, these are the pieces that we can really offer. And it's all about that fit. So, you know, how can we make sure that that's a good fit? How can we make sure that their spouses and their families feel like they belong there? I know that a lot of communities have some really good stories about what they do, whether that's taking them around, hooking them up with, you know, tickets to a local rodeo, just sending some text messages to say, hey, we've got some things happening. We'd really like to make sure that you're involved, and just giving that welcome and making sure that they have all of those bases covered from a local point of view. So one of the things that I'm just going to throw in there is that if you want to hear some of those stories and those specifics, and really get some ideas, is the conference is a really good place for that. So that's October 6th to 8th.
Yeah.
Throwing it back there. But it would give some really good insights to that. Lots of information in our toolkit as well.
And I just want to touch on the question from the town of Wembley in terms of the support extending to other healthcare professionals. So the question that I answered was specific to physicians, but the support in terms of the attraction and retention committees are across the board in all healthcare disciplines. So if the committees know that they have new healthcare professionals coming into the community, there's going to be effort to help integrate them and settle them and welcome them. And I will say, in terms of the town of Wembley, because I know it was highlighted quite a bit. I'm actually from the area, and I am part of the new clinic with the nurse practitioners there. So you have like firsthand somebody that is experiencing that, and it is fantastic. They're great. So yeah, our support is across the board. It is not just physician specific, it is all healthcare disciplines, and we've seen some incredible success.
All right. I'm going to go to Councillor Ketchum, who has a hand up. So the floor is yours.
Perfect. I just kind of wanted to highlight or give a heads up that we do plan to develop a resolution for the fall AB Munis, just something we've been discussing with our nurse practitioners here, and some things that we can advocate for them and helping them in their success. So just keep an eye open for that.
Well, thanks. You're getting a thumbs up from Debra. All right. Is there anyone else who might have their hand up?
I'm a counselor with the town of Black Falls, and we've had a physician retention issue in the past, and I'm wondering who would be the one to connect with to maybe help us with those challenges.
Physician retention?
Yes.
Yes. So what community are you with?
Black Falls.
Black Falls, yeah. So we have a community consultant. Her name is Anya, who represents and supports that area. And Emily, if you can actually pop in the consultant one sheet into the chat. So if you're wondering if we have a A&R committee in your area and which consultant corresponds with that area, there is the contact information there, and Anya would be your best bet.
Perfect. Appreciate it.
Yeah, no problem.
Do see one more question there in the chat.
Yeah.
So what kind of grants are available for attraction and retention committees? Our town has a fantastic committee, but we're currently handcuffed with funding. So
I can
there
touch on
is
that,
a
yeah.
couple of things for that.
Yeah. So Ryan, actually the town of Spirit River was approved for the attraction and retention community grant, and it was actually, I think it was just dispersed early January. So we do have $1,000 A&R grants that kind of recycle every April 1st. So the new application will be available April 1st. So that is what RhPAP can provide in terms of attraction and retention committee specific funding. And then Alicia, if you wanted to speak to other grant availability, you certainly can.
Sure. So in terms of grants, I mean, as Shanda had said, that's the one piece that we have there. We do have other in-kind supports that we provide. So we have been working with communities in some planning and road mapping pieces there to kind of get them going. We attend a lot of them in person and virtual when we can't make it to all of them. So some of those in-kind resources as well as the toolkit. But in terms of that funding piece, committees often look to, say, their municipalities for a little bit there. And I believe it was Debra who'd mentioned, you know, you give a rural community $1, they'll make it 10. They are so good with that. Many times the communities are really excited. The business folks and those in the communities are very excited to come together and say, hey, we're really happy to support this. We've seen examples of an appreciation dinner, let's say, and they have some money that they're going to spend, and they end up not having to spend anything because the businesses are so excited to support that, and those meals or the appreciation initiatives. So just taking a look at that local community capacity that you have and building on that really opens up some options. So hopefully that kind of gives you a little bit of a base there.
And I will say for the A&R grants, they are incredibly popular. So if your committee is interested in obtaining one of those grants, have your eyes open and have that application ready for the beginning of April, because they go very, very quickly.
They're in there. If you have any other questions, I know that Emily has popped in the chat both our email address, info@rhpap.ca, and our consultant one sheet, which, you know, very easy to reach all of us across the province. We're pretty accessible. I promise we're pretty friendly too. So you can reach out anytime, and we'd be happy to direct your question as best we can. Yeah. So thank you so much. I want to give a big shout out to all of the folks from both RMA and AB Munis who came on and made sure that all of this information was shared. So thank you. And thank you to Shanda for presenting all the information about RhPAP. And we hope all of this helps better equip you to collaborate and make change in your community in your efforts to keep healthcare close to home.